Welcome everybody to the August meeting of the Health Equity Outreach and Consumer Experience Advisory Committee. If Martin, you would mind reading your introductory remarks and take a roll.
Thank you, Mr. Chair. It is requested that participants introduce themselves every time they speak. Roll call votes will be taken for every action item. This meeting is being recorded for minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website. Thank you, Mr. Chair.
Thank you, Martin. And if we could have a roll call for attendance.
Yes, Mr. Chair. Sean King, Chair.
I'm here.
Thank you. Deb Poland.
Here.
Sheldon Taubman. Elisa Naira.
Here.
Thank you. Maria Matos.
Here.
Thank you. Jacqueline Sanchez.
Here.
Thank you. And Melissa Roberts on behalf of Gerald O'Sullivan, subject matter expert. Thank you, Mr. Chair. Yes, we do have a quorum.
Very good. Thank you, Martin. Next item on the agenda is public comment. I understand there is no public comment for today's agenda.
And Mr. Chair, would you like it for the senior leadership team to introduce themselves?
Oh, you know what? I jumped right over that. Yes, I'll turn it over to James and his team. If you could introduce yourselves, please.
Absolutely. Good morning, all. James Michelle, Access Health Connecticut.
Good morning, everyone. Holly Zwick, Director of Finance, Access Health Connecticut.
Good morning, everyone. Susan Rich-By, Director of Legal and Governmental Affairs, Access Health Connecticut.
Good morning, everyone. This is Glenn Jurgen, Director of Human Resources with Access Health CT.
Good morning. Tammy Hendricks, Director of Health Equity and Outreach, Access Health CT.
Mr. Chair, I think we completed our. Oh, Jesse's on. Jesse should introduce himself. He's on.
Oh, is Jesse on? Okay.
I see him on.
I'm here. Sorry, Jesse, you were at Access Health Connecticut.
Great.
Ellen is on as well.
Ellen Laramie, Outreach Manager. Thank you.
All right. Thank you, everybody, and welcome. Anybody else?
Hi, Karen Perez, Outreach Manager.
Thank you all.
My entire team decided to join. Oh, we got one more.
Sorry, good morning. Katie Hearn, Associate Director of the EPMO.
All right, we got a lot of folks from our Access Health team this morning. Welcome and thank you for the introductions. All right, I'll try not to skip anything else. Public comment. There is no public comment, correct?
There is no public comment. That's correct, Mr. Chair.
Okay, so then we will move to a review and approval of the April meeting minutes. Can I get a motion to approve those minutes?
So moved.
That's moved by Deb. Is there a second? I will go ahead and second. Any discussion on the minutes? Any edits or changes? Hearing none, Martin, if you could take the roll call vote, please.
Sean King.
Yes.
Deb Poland.
Yes.
Sheldon Taubman. Elisa Naira.
I have to abstain. I wasn't at that meeting.
Okay, thank you. Maria Matos.
Yes.
And Jacqueline Sanchez.
Yes.
Thank you.
All right, that motion carries. The minutes are approved. And now I'm going to turn things over to Tammy, who is going to start with the Health Equity and Outreach Department update and then flow through a few other items for us. Go ahead, Tammy. Good morning.
Thank you. Good morning. So Tammy Hendricks, Director of Health Equity and Outreach. I have lots of good updates for you all today. It's been a very busy year for our department, a lot of exciting developments. So starting out, the biggest change for us is the expansion of our team. We recently welcomed our new enrollment outreach specialists. I'm still trying to get the name straight. They're currently in training. We hired 4 new mobile enrollment outreach specialists. They're currently in training, and they will be fully ready to support the upcoming open enrollment period. And this team is really a big step forward for us. They'll be providing year-round enrollment and outreach support for our department, attending community events, working directly with consumers, but also supporting our navigators and certified application counselors. And in the past, that's been a big ask from our partners. They've struggled with providing the on-site enrollment. So this team really fills a critical gap there. And, as you know, over the years, our department has grown significantly. We now have well over 2,000 community partner contacts throughout the state. We've grown the Navigator program to now 6 navigators across the state. When I started in 2021, we had 2, which we were very fortunate for. But we've grown that program significantly. So this new team is really going to help us expand our reach even more, and make it easier for consumers to get the help that they need. With this new tool, with this new team, we're also exploring some tools that will allow consumers to schedule with them directly so that they can book in person and get access to that in-person help, and wherever the team is rotating to. So we're really excited about this expansion. It really strengthens our ability to meet people where they are, especially in those high-need communities that we serve throughout the state. But that's where we are so far with this team. A lot more to come as we get them fully trained, get some updates done to the website so that consumers can reach them directly, and get a rotating schedule for them. So they will be going to different community partners throughout the state. And we're really looking forward to it. So I'll pause here for any questions, feedback, comments.
Any questions or comments for Tammy?
Congratulations. And
Thank you so much.
anything we can do to help, we're here.
Yes, and we appreciate your partnership as always. And we will fully take you up on that offer. So open enrollment is coming up. We have a lot of fairs and events in the works. So we will definitely take you up on that offer.
Deb has her hand raised. Go ahead, Deb.
Yes, thank you. I'm excited about the 4 new outreach specialists also. So consumers can book directly with one of them through the website. If organizations like a community health center wanted to have some of the outreach specialists come to them, what would be the process for them to contact Access Health to request that they come on site to an event?
It
or
would
just
be the
in
same.
the lobby or anything?
Yeah, it would be the same way they contact us to do presentations or meetings. Just go through Karen, the outreach manager, or Jesse, really anyone on the team, and we will add them to the schedule. And so we will let community partners know what the schedule is for the team, and we'll make our way around. But just send us an email.
Okay. Perfect.
Yeah, easy peasy.
And then, Tammy, there's going to be additional scheduling tools that folks can use to request the specialists.
Yeah, so for our community partners, if they want to host an enrollment specialist on site, that's just contacting us, and we'll add that to the schedule, and we'll make sure that we rotate equally throughout the state and help community partners equally. But for consumers, we're working on a specific scheduling tool where they can sign up, and there's a lot of features that we're exploring right now, but schedule based on where these enrollment specialists are so that they can meet them in person, but also offer virtual help as well. So we're still this very new exploring that tool.
Okay.
So we will have more updates as we make some progress on that.
Do you have an estimated deployment timeline, or is it too soon to say?
Well, we do want this before open enrollment. So
Okay.
The next few months. Yeah.
Sounds good. Thank you.
Of course.
Any other
Sean,
questions or comments?
Very
Jim.
quickly, Sean, I just wanted to comment that we expanded Tammy's team because the need continues to grow, and again, we did all of this before the big whatever bill was signed by the president back in July 4th of this year. So the need is even greater than we had anticipated, but we are doing this because we saw a need out there to have year-round help for Connecticut residents as things become more and more challenging. Now they are even more challenging than we had ever imagined. So especially those folks who may be losing Medicaid and who may be kicked out of Medicaid, and some of our immigrant populations who are struggling to make sense of what's going on. So our presence in those communities are going to be more critical now than ever to make sure everyone has access. Everyone who need health insurance and wants health insurance have access to the resources that they need, so they would have it whenever they need it. So that's why we hired 4 additional staff to the year round.
Yeah.
Before that, we would have we'd pull from our internal staff to staff doing open enrollment, and that just was not enough. That create gaps in other parts of the company, and it just was not enough. So we had to make some investments for the communities that we represent. So that's how we got to where we are now.
That's great. Thank you, James. And I anticipate that our office will be making referrals through those to those specialists.
We welcome that,
especially once the scheduling tool is live. Yeah, thank you. All right. Seeing no other hands raised, Tammy, if you want to continue with the community conference report.
Of course. Okay, we can move forward with the slide. All right, so moving on to another big part of our work, the annual community conference. Throughout the year, we host smaller regional in-person meetings. We do monthly virtual calls for our community partners, but this event really brings everyone together. Our community partners, leaders, stakeholders, DSS, other agencies, even our brokers, all in one place before open enrollment. So this year, we will be covering a few different topics. So obviously the big, beautiful bill is top of mind for everyone, what it means for our consumers and how our partners can help us communicate these changes. That's going to be really important for us to relay that information. Updates on outreach and how to make marketing, how our marketing campaigns, marketing campaigns that we run through open enrollment, how we're going to be tackling misinformation and giving the correct information. And we'll also cover system changes and upgrades. So our CACs and brokers are fully prepared for open enrollment. That's what we typically do every year. And then this year, we'll do a lot of highlighting of our Business Plus platform for small businesses. So we will have speakers and panels, and it's pretty well-rounded. But beyond the presentations, we are building in time for networking, collaborations. We have vendors come in from different agencies, different partner agencies, to set up tables and provide resources. So that's always fun. We make it interactive. In general, I think we see around upwards of 200 partners in attendance. So it's always a great space for learning, networking, collaborating. So we're really excited about it this year. Hopefully you can all join us at this year's conference, which will be in Old Saybrook. And I'm happy to share those details with you as well. And I'll pause here for any questions.
Any questions or comments for Tammy on the community conference?
Hey, and sorry, Tim, did you list the date for the conference?
Yes, it is. I didn't list it here on the slide, but it's October 8th. I'm happy to send all of the details to you individually after the meeting.
Thank you.
All right. Thank you, Tammy. I'll let you keep momentum going with the
We'll
Broker
keep the
Academy
momentum
update.
going. All right. So, rounding out my presentation, just a quick update on the Broker Academy. This year's class has been fantastic, as with all the years, but we had 50 students this year. And this year we had a huge milestone. 29 students actually passed the state exam, which is the highest number of students to pass since the launch of the program. And so that is really a big win for us. The higher pass rate with a smaller group really highlights the yearly improvements we put into the programs. And we've made changes to the training schedules in the course. And so, of course, the cohort was fantastic and they were super dedicated as well. So these students really powered through. It's a hard course, and we have had 29 students pass the exam. So we're really excited about that higher pass rate, higher retention this year. And it speaks volumes to all the improvements that we've been making over the years. So graduation is set for the students at the end of October, just in time for open enrollment. And most importantly, you know, our graduates are a huge asset to us in outreach. Selfishly, they come to our in-person enrollment events, and they help us support the communities that we serve throughout the state. And so many of them are from those communities, so it's very helpful to have them there with us. So over the past 4 years, we've had over 100 graduates from the program statewide. And we continue to work with many of them. Now it's coming full circles. Many of the students who started in year one have become mentors, have opened their own businesses. So it's great to see the progress of this program. But that's all the updates I have for you all. And I'll pause here if you have any questions, comments, or concerns.
Just from a little bit of context of what Tammy was saying. I think last year, our fourth highest producer on the exchange was one of the graduates. But I think, was he a first-year graduate?
He was a first-year graduate.
First-year graduate.
Yeah.
So, which means that he's earning pretty good income monthly as a result of that. But just kind of put things in perspective, the difference that these folks are making, not just in our customers' lives, but also in their own personal lives as well.
Yeah, thank you, James, Tammy. Any other comments on the Broker Academy? I'll just say that this has been such a great initiative over the past few years, and to see as an initiative it be successful, and to see the individual successes of the folks who participate, as James mentioned, not only for their own benefit but for the benefit of the communities that they're serving. I think it's great, and we appreciate you highlighting it for us, and keep up the good work, and hopefully it continues to be a benefit to folks out there.
Thank you so much, Mr. Chair.
Okay. Tammy's off the hot seat, and now we have Catherine is going to give us the open enrollment readiness update.
Thank you very much. Good morning. I'm Katie Hearn. I'm the Associate Director of the Enterprise Budget Management Office of Access Health Connecticut. Today, I'm going to walk through some open enrollment readiness updates regarding technology and marketing. So first off, our open enrollment 13 will be of the same duration as it was last year. It will be held from November 1st through January 15th. And our Access Health departments have been working over the summer to prepare for it. In addition to our usual OE activities, Access Health Connecticut has been preparing for implementing changes from HR 1 and the 2025 Marketplace Integrity and Affordability Final Rule issued by CMS. Later in the presentation, Director of Legal and Governmental Affairs, Susan Richby, will provide further details about these changes. Each year prior to open enrollment, we make sure our enrollment system is ready with a system release. And this year, that release will be scheduled for October the 10th. The release changes this year include the expiration of the enhanced subsidies at the end of the year, a change for DACA individuals who will no longer be eligible to purchase coverage through the exchange, and another eligibility change affecting certain immigrants not eligible for Medicaid due to their immigration status whose incomes are below 100% of the FPL. They will no longer be eligible for tax credits in plan year 26. Next slide, please. For open enrollment this year, our eligibility projection notices for qualified health plans and for dental plans will be generated and sent to customers between October 17th and 27th. Our auto renewal notices for qualified health plan and dental plans are expected to run between November 12th and 25th. And each year, we have a window shopping period prior to open enrollment, and that will be, as usual, the last week of October. And again, we will be open for customers to shop for plans for the 2026 plan year, beginning Saturday, November 1st. Next slide, please. These are some updates from Director of Marketing, Caroline Rouette. I have some federal changes and then some OE specific marketing changes to cover. Access Health Connecticut has launched a federal changes landing page on the website. The purpose is to help customers and other stakeholders understand the changes and their impact. The federal changes and their impact are outlined by plan year from now through plan year 28. The page has helpful messaging and resources and includes what customers can do now, which is prepare to shop for a plan during the upcoming OE. As a result of the federal changes, shopping around for a plan will be especially important for many customers this year. The page includes a video about what brokers do and how to find a broker to receive free help navigating these changes. The marketing team is also working on direct-to-consumer messaging via email, mail, and text messaging. That will start before open enrollment to help customers who will be impacted most by the federal changes understand the changes and what they can do. These audiences include the DACA population, which I mentioned, which is less than 200 enrollees, customers who currently receive financial help, including those who earn income above 400% of the federal poverty level. They are at risk of losing all subsidies. And also certain immigrants who do not qualify for Medicaid and whose incomes are under 100% of the FPL. They will no longer get financial help when purchasing health insurance. Additionally, the senior leadership team has made several presentations on the topic, including at the recent rate hearing hosted by the Connecticut Department of Insurance, Connecticut Insurance Department. Updates to other stakeholders, including brokers, certified application counselors, and community partners, are being made via email campaigns. And the topic will also be presented during the annual community conference, which Director Tammy Hendricks just spoke about. Next, please. Moving into OE-specific marketing, the Open Enrollment 13 campaign is supported by a data-driven strategy designed to reach the individuals who need our messaging the most. Two core populations within the target audience include uninsured individuals and households with incomes at approximately 400% of the federal poverty level. This population, as I said, is set to lose financial help if their income is above 400% of the FPL. Data analysis has revealed that a 99% overlap in zip codes that have the highest populations in Connecticut of the uninsured, as well as the 400% CLIF audience. So this is a strong correlation that confirms our zip code selection is effectively including communities with the greatest need and is enabling efficient use of our paid media investment. To amplify the digital-first media approach, complementary channels have been integrated to reinforce OE messaging statewide, including broadcast media such as TV and radio, billboards, and placements in local newspapers and community publications. The influence of earned media coverage also plays a major role in expanding our reach throughout Connecticut. The full media plan and production shoot will be completed in September, And we will provide more open enrollment updates again at the September board meeting. If you have any further information regarding our marketing efforts, we can reach out to Director of Marketing Caroline Ruette. Thank you very much for your time.
All right, thank you, Katie. Any questions or comments? Seeing no hands, we will move on with our agenda to a summary of federal changes and impacts to Connecticut residents by Susan.
Thank you very much. We have a lot going on here as we've been talking about today, and actually as of last Friday, a stay was issued in a case that even impacts us even more. So we'll take it from the top. Probably the item that people are thinking about the most is the One Big Beautiful Bill that was signed into law on July 4th. That has changes that will impact consumers, Medicaid, and also QHP consumers. And for QHP consumers, it starts for 2026, 27, and 28. Another big item that's dictating a lot of changes on the marketplace is the final rule on marketplace integrity and affordability that was published on June 25th, 2025. And the court decision I was just referencing, the case is called City of Columbus versus Robert F. Kennedy Jr. That came out last Friday, and that is a case filed by several cities and some medical groups challenging the implementation of some provisions in the final rule. So that one impacts some of the items in the final rule. And then the other big item that we've been talking about today, and perhaps maybe the biggest item across the board impacting the most people, is the likely expiration of the enhanced premium tax credits. These enhanced credits have been in place since 2021, and they are set to expire at the end of this year if Congress does not take action. You go to the next slide, please. So as we said, high level, these are the three big items. So we've tried to break it down here to make it easier for people to digest, to look at the 2026 impacts first. So the bill will eliminate eligibility for financial assistance for consumers that are lawfully present but ineligible for Medicaid due to their immigration status, those with income below 100% of the federal poverty level who normally would not be eligible for a premium tax credit, but they are because of this eligibility status. Starting in 2026, they will no longer be eligible for financial help on the exchange. They can still buy a plan, but it will be with no financial assistance. The final rule, as Katie and Tammy have mentioned, has a number of different impacts. One of those is ending eligibility for DACA recipients, and that is starting this year. That is starting shortly. We have a small number of DACA recipients who enrolled in Connecticut. Some states have much larger populations, but we'll do everything we can to reach out to these folks to make them aware of this unfortunate change. Another item, some of these items are impacted by the City of Columbus case. So this next one I have listed here, allowing carriers to require consumers to pay past due premium before they effectuate the plan for the new year. This was part of the stay. So this is on hold for right now. And some of the other items that are on hold for right now are some changes to the income verification process. And this other item that's listed here, the elimination of the special enrollment period for consumers with income below 150% of the federal poverty level. This one is not impacted by the lawsuit. And so this one is now in effect. That one went into effect on August 25th of this year. We are fortunate in Connecticut because of the Covered Connecticut program, which has year-round enrollment. We did not have a lot of consumers who needed or took advantage of the special enrollment. So for consumers at this income level, they still have the Covered Connecticut program available to them. And then, as we've been talking about, a big impact across the board, and we'll go into it with some more numbers in another slide, is the likely expiration of the enhanced premium tax credits. We do want to stress that all financial help is not going away. The original ACA premium tax credits will still be in place and the cost sharing reductions. But it does change the contribution percentages, so it makes subsidies less rich, and it also takes away eligibility for those with income over 400%. And this will increase the state's cost for the Covered Connecticut program because that is tied to the federal subsidies with the enhanced premium tax credits. You go to the next slide, please. So all of these different effects, we've tried to look at everything. Everyone's asked, you know, what kind of impact is this going to have on your population? So based on our currently enrolled population, which is about 155,000 individuals, we estimate that over the next nine years, up to 2034, that it could possibly lead to 30 to 35% of this current population being uninsured. But we will do everything we can to hopefully help consumers maintain their coverage. And as we said, like we keep, you know, trying to also message that all financial help is not going away, that the original ACA premium subsidies and cost sharing reductions will still be in place. You go to the next slide. So what is the impact of the enhanced premium tax credits going away? Currently, with 155,000 individuals enrolled right now, there are a little over 141,000 of those people. 90% of those folks are receiving financial assistance. So everyone receiving financial help will be impacted. For some, for those consumers with income over 400% of the federal poverty level, obviously the income will be much greater, but it does impact everyone. And I believe James pointed out to us internally, I think we just this week crossed the threshold of having over 50,000 or 50,000 enrollees in Covered Connecticut, which is fantastic news for the state. But that's just going to be an impact for the state on the increased costs for those folks. You go to the next slide, please. Thank you. Something that we mentioned, one of the items for 2026, it's that consumers who are lawfully present, but they're ineligible for Medicaid because of their immigration status, and they have an income below 100% of the FPL, who up until now have been able to get premium tax credit assistance and cost sharing reductions, they will no longer be eligible for this financial assistance starting in 2026. Based on our current enrollment, this is estimated to be about 5,000 customers. So this is a pretty significant impact. You go to the next slide, they still will be able to enroll in coverage, but with no financial help. So with income at that percentage, obviously that would be a huge challenge. One of the other items in the rule that has not been touched in the lawsuit is the change to what's called the premium adjustment percentage methodology. This impacts affordability in a number of different ways, and it changes maximum out-of-pocket amounts in plans. So it allows carriers to offer plans with higher maximum out-of-pockets. The carriers did file a few non-standard plans using those higher limits in anticipation of the rule being finalized. We just want to point out that for all of the Access Health CT standard plans, we did not use the higher percentages. We went with what the existing percentages were. So those maximum out-of-pockets did not increase as high as some of these other ones could have. But an analysis shows that this increase to the maximum out-of-pocket represents a 15% increase compared to the 2025 limit. So this is significant. You go to the next slide, please. Also, something that is really going to have a big impact for consumers. Up until now, the ACA has provided protections, financial protections for lower income consumers with premium tax credit reconciliation. Everyone who gets a tax credit, as you all hopefully probably know, is required to file their tax return each year and reconcile whether they got the correct amount. For people who may have gotten excess premium tax credit amounts, more than they were eligible for based on their actual income at the end of the year, there were repayment caps that have been in place. since the beginning of the ACA, protecting consumers with income below 400% of the federal poverty level. All of those repayment caps are going away as a result of the One Big Beautiful Bill. So if a consumer, a low-income consumer, or any consumer has excess premium tax credits when they file their tax return, they will be required to repay all of those excess amounts to the IRS. So this is a big change. This goes into effect for tax year 2026 when people would file their returns in 2027. So we are going to really include that messaging for people going into this OE for 2026, that it's more important than ever to really get your income right. And if your income changes during the year, to come in and update your application. If you go to the next slide. And then finally, oh, sorry,
Susan,
James, did you have something?
Oh, that was me. Susan, it's Sean.
Sorry.
Just real quick, the messaging on the excess APTC, that I assume you'll continue that throughout the year for folks
yes,
as well,
absolutely.
just to make sure that they're constantly reminded to update their income so they don't find themselves in that position at the end of the year.
Absolutely. Yes,
Okay.
we want to do everything we can.
So Sean,
Thank you.
we do that now. We do that continuously through our communication, but we just have to reinforce that as we go out throughout the year, because this should be real money coming out of people's pockets. It could be
the caps before were at much lower levels for some of the really lower income consumers. It really protected them from, being stuck with a huge tax bill going back. And so all of that is going away. So it's vitally important that people really be on top of their actual income.
Yeah,
So
because
thank you for asking.
I remember the early days 10 years ago when people were really shocked at how much they owed on their tax returns.
Yes.
And so we want to avoid that again if we can for folks. Yeah. Thank you.
And Sean, as you might imagine, that population that we work with, hardworking Americans who some of them the tax refunds is part of their annual budget for their families, and any impact to that at all could really throw the entire family's budget off for the whole year. So that's why it's important that that they are aware of this, so they could plan accordingly.
Yeah,
because we don't want them to be shocked at year end.
Can I have?
Sorry.
So this is going to happen after they fill out their taxes for this year, just because
It's not for 2025. It's for 2026 is the first tax year that those caps are going away for. So it won't hit people till they file returns in 27 for 26. But as far as from a messaging perspective, it's really important and I don't know how many consumers even know about these repayment caps or how aware they are, but it's going to be vitally important for 2026 for people to do everything they can to get their income correct, and update it. We know people's income changes. A lot of our population, is self-employed, may work multiple jobs, so they may have fluctuating income. So it's vitally important that they really stay on top of that. Certainly big changes in income. And all of our notices tell people they're supposed to come in and report. Whether people do or they pay attention, is another issue. But, we're really going to work with all of our community channels to make sure that this message is made, given out to people.
Thank you.
Thank you. So what is our plan? What is our action plan? We've talked a little bit about that with the tax protections going away. So Tammy's team, Health Equity and Outreach, will, as always, follow their community first data-driven approach. Tammy talked about, we have 4 new mobile enrollment specialists. We will have a variety of enrollment fairs throughout the state, and really having an increased navigator presence, activating our trusted resources within the community. So we will make sure that they have all the information they need so that they can communicate that to the communities that they work with throughout the year. Marketing, likewise, will have clear messaging. As I think Katie mentioned, we have a federal changes page that has just gone up. DSS has also put up a page about the Medicaid changes. And then we're going to do everything we can to reach out to people through various channels, mass media, to make sure that they are aware of these changes. And I think the most important message is to make sure that people know that we're still here. We're here to help. We have a variety of plans available and different price points. So more than any other year, maybe this is the year to really work with a broker, really do your research and shop for the best plan. You know, maybe staying in the plan you were in for 2025 may not be the best thing for you financially for 2026, but there will be another option for you. That's the message we want to make sure people understand. And there is still financial help available. And as always, we have free help in person, online, and over the phone. And then we are making changes to our operations and technology, increasing our call center staffing. We assume there will be increased call center volume. We have made enhancements to our IVR system. So hopefully that will actually really good timing that was put in place this summer. That will really help consumers and help the call center, helping people. And also, you know, we have necessary changes we have to make to our online system for these changes. So all of these actions are in place to make sure that we're here to support all of our consumers. I'll pause if there are any questions.
Sheldon has his hand up. Go ahead, Sheldon.
Yeah, hi. Thanks, Susan. Thanks, everybody else, for the presentations. First of all, I'm really sorry that this is all happening. These negative changes, it's really, really unfortunate. I did have a couple of questions about a couple of them. There's lots, but two specifically. Let's see which slide this is at. The slide that sort of says the federal changes, the summary, I guess 18. So the first thing under the, I'll call it HR1 instead of the title you give it. So as I understand it, this is about people who are ineligible for Medicaid because of the 5-year, they're lawfully here, they're LPRs.
Most of them are probably because of the 5-year bar, but there may be some others that because of they're lawfully present, but they're not eligible for Medicaid because of their immigration status. So up until this point, they have been able to enroll through the exchange and get premium tax credit assistance, even though their income is below 100%. That's the floor normally for eligibility for premium tax credits because of the interplay with Medicaid. But because these folks are not eligible, they're lawfully present, but they're not eligible for Medicaid because of immigration status. They, up until this point, have been able to get financial help to enroll in a QHP. And I would think the lion's share of them are probably in covered Connecticut because of their income. But unfortunately, this eligibility for financial help on the exchange will be going away in 2026.
So they're still eligible to sign up, but there's no
They can
help
sign
at all.
up, but with no financial help.
Right,
So they
which is
couldn't,
probably very well.
right, which is probably an impossibility. Exactly. They have
Right,
income
and-
below 100%.
So,
If their
but-
income goes over 100%, then they could be eligible for, if their income changes, and then they could be eligible for financial assistance. You know, that was that rule that allowed them to get financial help even though they were below the floor, but that is going away for 2026.
Right, and the fact that you might be okay if you're over 100% makes absolutely no sense, but we didn't make those rules, so just
Yes.
understand it. And then my other questions about covered Connecticut, you just mentioned, which is 50,000. I didn't realize there was that many on there. So I'm trying to understand what happens under the federal law to them and what Connecticut would have to do to hold people harmless. Tell me if I'm right that there's like 3 different kinds of harm. One, from the federal, in terms of the covered Connecticut group of exchange enrollees. One is as you discussed, the advanced premium tax credits are being reduced. So now they'll have to pay more, to
The state's
premium.
portion will increase, yeah.
The state's portion will increase. Okay.
Yeah, because
So,
the
but
way
they won't-
covered Connecticut is structured, the state pays for people who are eligible and meet the requirements. the state pays the consumer portion of premium and the consumer portion of cost sharing. So the cost sharing wouldn't change, but the premium, will probably change, fairly significantly because the federal tax credits will get smaller. So the state will have a bigger share to pick up.
Is that I don't know the law on this. Is that the status quo? Is it if nothing changes on the state level, the state will have to pay more, but these people will be protected in terms of the increase?
My understanding is the way the Covered Connecticut legislation was drafted, it doesn't, it doesn't have something like the expiration of the enhanced tax credits isn't like a trigger for Covered Connecticut to end. So the state, is absolutely looking at that. The state does have a waiver, an 1115 waiver with CMS for the state's cost of Covered Connecticut. So the feds do pay, I think it may be half, I'm not sure the exact amount. The feds do kick in for the state's cost for the program as well. But I would leave that up to, DSS and folks at the state. But I don't believe the legislation has a trigger in there that would make the program just suddenly end. And they're in a 5-year demonstration waiver, which goes through 2027.
Right. And there also would be no, for the consumer, increase in the cost sharing?
No, this doesn't change cost sharing. It's really the big change is the premium.
Okay.
Change.
And then the last piece is in Covered Connecticut is coverage of certain services that are not normally available in exchange plans, but are covered under Medicaid, like dental and medical transportation. Are those not affected?
No, I don't believe so, because that's part of the state's wrap,
Right.
It's not tied to the QHPs or the federal subsidies. Yeah.
So again, not holding you to it, but you think the way this works is that the state then is on the hook for more. It's not that the individual will be required to. Yeah.
Right.
Okay.
The way the program is structured right now, would increase the state's cost. And like I said, there are those 5,000 people that will lose eligibility for financial help. Most of them, I believe, are in Covered Connecticut. So that's something that the state is looking at as well.
Right. So my other question is not in your presentation, but I'm sure you've thought about it. And that is in January 27, when the new horrendous work reporting requirements go into effect for Husky D. This is going to be a mess. We know that from Georgia and Arkansas.
Right.
Is the part about reporting your work or your exemption, is that going to be on the DSS side and the DSS call center?
Yeah,
DSS is working that all out.
Yeah, that is all Medicaid. That's all Medicaid requirements. That's a DSS. That's a DSS.
No, I'm not asking. I know it's a DSS requirement being posed by the feds. That's not my question. Who is going to be handling that? The individual, the thousands of people who say, I am working, how come you cut me? That kind of thing. Who's going to be, or I'm trying to report my work stuff and you're not getting, or I'm exempt and you're not getting it. Will that be on the DSS side?
Yes. DSS is responsible for doing all reporting involving Medicaid recipients, including the new requirements. Now, we'll be working collaboratively with DSS to help them out as much as we can. As you know, Sheldon, we are not allowed to expend any assessment dollars for Medicaid, for the Medicaid program. But we will be working with DSS. We started working with DSS specifically around this area, strategizing how to implement it. But they have a little bit of time to get that in place. But that has been worked on by DSS as we speak, and we will be there to support them in any way that they need our help.
Okay, thanks. I just wanted to know division. Yep, thanks.
No, thank you. And just to note too, the bill does also state that if a consumer fails eligibility for Medicaid due to not meeting the work requirement or an exemption, they are likewise not eligible for financial help through the exchange.
Yeah.
So
thanks.
They carried, just like they did with the other, they carried everything through, just like the other immigration changes, they carried them through for Medicaid through exchanges as well.
Right. Yeah, thanks for reminding us about that one too.
Sorry. Yeah, that's why we were just focusing on 2026 for now. We'll leave 27 and 28 for later, but yes.
Yeah.
Thank you for the
Thanks a lot.
questions.
Appreciate it.
Yeah, thank you, Sheldon. Good questions. Anybody else? Questions or thoughts? Thank you, Susan, for that thorough, comprehensive, and somewhat sobering report. With that, I'm gonna turn it over to James for a brief update on strategic initiatives. Go ahead, James.
Thank you, Mr. Chairman. Very quickly, Susan mentioned the call center. We do have a new call center contract that requires new technology to be deployed to make it easier, more efficient, and faster for customers to get access. And again, that went live on July 8th of this year, last month. And also, one of the features of the new contract is that we will have real-time different language translation in real time as opposed to using the language line. The initial languages will be Spanish, Polish, I believe Portuguese, Haitian Creole. Those are the top 5 common languages connected right now, but more languages will be added. Again, this is using technology to do translation directly between the customer and our agent on the phone, as opposed to using a language line. That's been very, very well received. And also, Susan indicated that we have a new IVR where we are leveraging the latest technology to give our customers more options for self-service and communicating directly with our system, get the information that they need more quick, and also more efficiently and more timely. So again, more to come on that we continue to improve that process as we move forward towards open enrollment, but it is up and running. It's getting good results so far. The other initiative we have going on is the ICRA platform. This is we've labeled it Business Plus. This is where small businesses could use this new platform to enroll their employees directly into the individual marketplace if they meet certain criteria. That went live on July 1st of this year. It's a brand new platform with the Access Health is the only exchange that has developed this platform implemented across the country. This was created by the Trump administration during his first time in office to help small businesses get access to the individual market for their employees. And we are also working on developing a SHOP platform. This is a small group health insurance program for small businesses. And we're just starting that process to develop a new platform. Currently, we use a vendor's system that is not the most effective, most efficient way to give access to small businesses in Connecticut. So we are working with the same vendor that helped us develop the Business Plus platform, a small business group health insurance program, and that's gonna slate to go live next year, in the fall of next year. And the biggest one of all is our 10 Clicks project. 10 Clicks is the system we currently use to enroll individuals in health insurance as well as Medicaid, Husky. We've been using the same system since October 1st, 2013. We have made some enhancements, minor enhancements to make it on the fringes, but the core of the system is still the same. There's been no major improvement to the system at all, and it is always integrated. It's very expensive to manage, to make any changes. All the changes Susan mentioned that we would have to make to our system to accommodate the big beautiful bill, as well as the other changes coming from CMS. They are very expensive because of how our system was built about 12, 13, 14 years ago. So we looking forward to start this new platform development. We're going to take our time. Fortunately for us, we have 13 years of information that we could use to develop the new system. The system we currently use, we had nothing at all to use to develop it because it was a brand new system. No one had, it was a new platform for new exchanges where there's no data. Now we have information about our customers, where they live, how they actually shop. So everything that we have, and we also have our employees who have been with us So most of them have been with us since we started back in 2013. We also have our partners in the communities, all the community organizations that Tammy talked about. We have our agents. We have we have over 2,000 partners that we leverage to get access to communities. So we are using all of that information to develop the new system so it'll be more efficient, more effective, leveraging the latest technology. So that 2 years from now, and the goal is to have the system up and running for our 15th open enrollment, which will be for January 1st, 2028. More to come on that, but that would be a huge lift for the entire organization. And we are leveraging our employees, our internal resources to develop this new platform as opposed to using a vendor from the outside. So more to come on that. Just want to give you an update on that. So as we move forward, we will give you an update on the status of the project as we move forward. Mr. Chairman, those are the 4 items that I wanted to give the committee an update on. Major strategic initiative, 2 of them are up and running. The other 2 are in progress.
All right, thank you, James. Quick question on ICRA. Do we have any numbers or other information on uptake? I know it's only been less than 2 months that it's been live, but
John has it up and running. Right now, John has trained over 300 brokers on how to use the system. I believe we have about 175 companies who are looking at enrolling their employees to it. We do have some numbers, people who have actually enrolled, and they go online October and November and December. But the big uptick for us will be the upcoming open enrollment is when we're really going to see some transition. The goal is to have between 5,000 and 7,500 new enrollees through small businesses by the end of 2026.
Okay. All right, we'll look forward to more information on that as we get closer to the end of the year. Thanks.
Yes, thank you.
Any other questions or comments for James? All right, seeing none, and mindful of everybody's time, we're coming up at the end of the hour. At this time, I will solicit a motion to adjourn. Any member of the committee? Elisa moves to adjourn. Any second?
Second. I second.
Second by Maria. All right. Thank you, everybody. We'll take a roll call vote on the motion.
Okay. Sean King,
Yes.
Deb Poland, Sheldon Laupman.
Yes.
Thank you. Elisa Naira. Ms. Naira.
Yes.
Okay, thank you. Maria Matos
Yes.
and Jacqueline Sanchez.
Yes.
Thank you.
All right, motion carries. Thank you so much, everybody. Good to see you all. Thanks for the good discussion.
Thank you.
Thank you.
See you soon in December. Bye-bye.
Everybody remember. Bye.